tonight as the state health department reports Tennessee has officially topped 200,000 cases, recording more than 1,600 new COVID cases just today. 17 new deaths have also been reported, while 791 people continue to be treated at the hospital. Fox 17 News' Rachel Teedy is live on Lower Broadway with what these new numbers could mean for people here in Nashville and really all over Tennessee.
Nikki, it's been 7 months since this pandemic arrived in Tennessee. And of course, we've seen changes to Broadway, but not just Broadway, all over Middle Tennessee as people tried to adapt. And now we have more than 200,000 positive cases in the state of Tennessee.
201,210 cases. That's where Tennessee sits when it comes to COVID-19 cases so far. Deaths up too. 17 since yesterday, now sitting at about 2,600.
It really breaks my heart because these are cases, these are illnesses, and these are deaths that don't necessarily need to happen.
Nurse Mary Beth West helped take care of COVID-19 patients and is a part of the Vanderbilt COVID-19 vaccine trial. She said she's received both vaccines already as part of that trial, and now scientists will see if antibodies are in her system, helping her to better beat the virus. Many are eagerly awaiting the vaccine as big names battle the virus, like professional athletes here in Nashville and even the president.
I am hoping a little bit that maybe people who thought like this only happens to the old, the sick, the pre-existing conditions might be like, wow, this can happen to anyone. Anyone can get really sick.
The Titans now have about 20 people, players and staff, infected.
We've asked our players to, in light of the recent tests, to not gather, whether that's a league protocol or us asking them so that we can just avoid close contacts.
Nashville Soccer Club also dealing with its first positive case. Nashville Mayor John Cooper tweeted this morning that Nashville is dealing with 29,225 cases in Davidson County, up 67 since yesterday. Davidson County is seeing 85 hospitalizations, a steady decline. Statewide, we're at 791, down 64 from yesterday. So as the pandemic continues, now with a commander-in-chief battling the virus, Mary Beth hopes it ends soon.
So I'm hoping this will encourage more people to wear masks, limit their contact with others, and just do those safety measures so that we can all get through this.
And across Tennessee, different cities, different counties in different stages of reopening. Nashville is in phase 3. So if you want a further breakdown for what that might mean for you, head to fox17.com.
Medical researchers are working to get to the bottom of a trend in the coronavirus pandemic here in Tennessee. As case numbers stabilize or decline in urban areas like Nashville and Memphis, our smaller counties are seeing a spike. And as Fox 17 News' Nikki Jenowitz is live in Murray County to explain, the reason why is largely a mystery at this point, correct?
Yes, Erica, according to the county website, right now there's 2,528 confirmed cases of coronavirus right now here in Murray County. I know that does not sound like a lot when compared to more urban areas, but it is nearly double the cases this county saw just 2 weeks ago. And the problem is researchers have no idea what's causing it. Peaceful and quiet, but highly active when it comes to coronavirus. That's what new data from Vanderbilt University Medical Center shows about the pandemic's impact on Tennessee's rural communities. In the last 10 days, nearly 100 new cases got reported in the areas you see in the red, including a considerable portion of Murray, Fentress, and Cheatham counties. Not Davidson or Shelby counties, as you may expect.
It's unclear why. We don't have the detailed contact tracing information, unfortunately, to tell us exactly where these cases are deriving from.
But researchers do know who's getting it.
What we can say, based on the cases that are coming out of rural areas, is that by and large, unlike in some of the urban areas, it's concentrated among older adults.
Concerning because older adults are more at risk for hospitalization.
The activities that older adults, and by that I mean people over, let's say, age 45 and above, whatever activities they're engaging in is potentially exposing them and their families to becoming infected.
The Murray County Fair drew record crowds and controversy this year amid fears the summer tradition may contribute to an outbreak. But so far, state contact tracing efforts have only identified congregate settings like nursing homes and prisons as hotbed areas, not large-scale events like this.
We felt it was important to social distance, to keep people separated. We did shut down all our internal inside exhibits and stuff, so everything was done outside. We're delighted that people could come out and enjoy, because people's been cooped up too long.
Now, I also asked these Vanderbilt researchers if the relaxed mask mandates are perhaps contributing to the surge in cases that we're seeing in these rural counties, and they said they can't really confirm that either. However, you may recall Murray County Mayor Andy Ogles received a lot of scrutiny this summer for refusing to ever issue a mask mandate in Murray County, saying that it was unconstitutional.
Tonight, a mother is begging the district to let her child with learning disabilities return to in-person classes. Fox 17 News' Kathleen Surrey is live in Nashville with more on the mother's frustrations. Kathleen.
Well, Erica, there's no question that virtual learning has been a big challenge this year for parents, teachers, and students. But this mother says her daughter, who has a learning disability, not only wants to be back in the classroom, but needs to be back there in order to pass her senior year.
Bernadette Ash Minyard is fed up with virtual learning.
I really wish that my facial expression could describe how I'm feeling inside, because I'm boiling right now.
Her daughter is a senior at Hillwood High School and has a learning disability that impacts her comprehension, specifically with math and reading. She's been on an individualized education program, or IEP, since she was in first grade. Ash Minyard asked us to not share her daughter's name or show her face. Even before COVID-19 caused metro schools to go virtual, she says her daughter struggled with academics. That's even when she and other students had their own teacher who would assist them in larger class settings. But now that everything is virtual, Ash Minyard says she's failing 6 courses.
All the time she's frustrated, or the thing's not working, or it's freezing up, or she can't ask a question.
Metro schools started phasing in students with exceptional needs last month. But when Ash Minyard asked the school if this applied to her daughter,
and they told me that she was not disabled enough to be in-person school. And I said, why is that? Because she has an IEP. And they couldn't give me any kind of answer.
It's also worth noting that in Metro School's reopening plan, high school students won't return until January.
Because she has a learning disability, and it shouldn't matter that she's a senior. The disability should override the class.
We called Metro Schools, and their spokesperson explains they can't disclose information about students, but he also says both the Hillwood High School principal and Metro School's Director of Exceptional Education are trying to work with Ash Minyard to get her daughter more help.
Now, that Metro School spokesperson says they've also created something called Continuous Learning Individualized Plans, or CLIPs, for students who already have those pre-existing IEP plans to help them out during virtual learning. He says parents have also had several virtual support meetings for this type of virtual learning experience.